I was a startup dental practice, and so we opened our doors in 2013 as a small startup practice. We started with dental technology at that time with CEREC and the milling unit, doing same-day crowns, and really saw that as a practice builder for us. And so as we were incorporating CBCT into our practice, we really went with Galileos at that time and now Axeos because it really incorporated seamlessly into that digital impression technology and that workflow from Sirona. And so building on that with the CBCT, that led us into implants and guided surgery. And from there, we developed an in-house laboratory. So we have a full suite of in-lab products. And so we have the INEOS scanner, the benchtop scanner, we have the MCX5 mill. That allowed us to do bigger lab cases in-house and kind of control the quality and the standards and the workflow on the lab side. And really from there, it just escalated into, dental sleep medicine, clear aligners, all of that really integrated seamlessly into the workflow from Sirona. So the biggest consideration that I went through when I was going to incorporate a CBCT unit into my practice truly was the workflow. And I had already started my journey down, the digital dental technology path. And so when I was looking and evaluating systems, I really wanted one that could really incorporate into my practice seamlessly with the workflow that I already had going and that my team was already used to. There were several tipping points along the way that kind of triggered me to incorporate each piece of technology into my practice at the time I did. So in the beginning as a startup, we really wanted to change the way patients experience dental care. We wanted to make it easier, faster, quicker healing times, and overall a better experience. And right off the bat, that meant same-day dentistry through the Sirona crown system, CEREC and the milling in-house, and doing all of that. The tipping point for our cone beam integration was really when I saw the limitations of 2D radiology. And so, the first time I saw a 2D radiograph next to a 3D CBCT image of the same area, and the vast difference in what you could diagnose and what was hiding behind the 2D that we couldn't see, that was really the tipping point, along with me wanting to integrate guided surgery into my practice. One of the biggest limitations that I found with 2D radiology is that we would have patients come in that would describe these clinical symptoms. They're having pain, nondescript pain, and the 2D radiograph didn't really give us any additional information. We were unable to reproduce their symptoms clinically in the office when they would come in. And, before CBCT, we would say, we would monitor it, we can't reproduce your symptoms today. We'll follow you. We'll see you in a week and see if you're still experiencing those symptoms. And the difference is now we're able to take that CBCT and we're able to see so much more than we can on the 2D, and it makes that diagnosis easier and more accurate. As we're taking cone beams on our patients to do diagnosis and treatment planning, that we saw some things that were pretty surprising. On one patient, she gave us a history of having all 4 of her wisdom teeth extracted, no postoperative complications, and as we took our scan, we saw that she had an additional wisdom tooth, and it wasn't even in the maxilla, it was in the upper part of her maxillary sinus, and it had been there for a very long time, and she had no idea. And so sometimes you see some surprising things. Another case, we had a teenage patient who asymptomatic, no issues, and the cone beam revealed that she had a dentigerous cyst that started at the ramus of her mandible and went all the way to her midline. And so that turned into something we were able to catch, and the patient was able to have treated successfully, but it's something that the cone beam CBCT allowed us to see very easily. The ROI question comes up across the board for any type of technology that we incorporate into our practice. So obviously we can see the tangible aspects of the return on investment. So we can see that we're able to diagnose endodontic lesions better. So the number of root canals that we're doing is more substantial than we were in the past. We can see the number of implants that we're doing increase because the surgeries, from a guided surgery standpoint, are quicker, they're more predictable, they're more accurate, and the patients heal much quicker following that because it's a smaller surgical field. We saw the implementation of dental sleep medicine into our practice and the explosion of those appliances and really addressing that medical need in our patients. So from an ROI standpoint and the amount of treatment that's done, that's very easy to track, and we've definitely seen that in our practice. On the other side, the kind of intangible benefits of integrating this technology into your practice, especially for us as a startup, it was a practice differentiator and it was a practice builder. And so our practice has been blessed with great growth, and I attribute a lot of that to our philosophy of care being tech forward and these seamless workflows that we're able to provide for our patients because of the dental technology that we've chosen to incorporate into our practice. And so the ROI question is always tricky because, as dentists, we always want hard numbers, and we've definitely seen the numbers. But almost more important for us has been the intangible. The patients take an interest in the technology. They want to know more about the technology. They're talking about our practice outside the walls of the office because of the technology that they see at our practice that they don't see anywhere else. In our practice, we have a separate consultation room where we can set patients down and we can walk them through the story of their mouth. And this technology, from the intraoral scanners to cone beam, allows us to have real tangible things that they can see and visualize to kind of make that connection for case acceptance. The great thing about Axeos and the cone beam software is that it can really be done anywhere in your practice. And so we have our consult room that we use when necessary, but we can also do this in the hygiene chair side and walk them through many aspects of their treatment plan on the cone beam. I can even sit in the operatory if we're discussing if a patient is a candidate for a dental implant. I can drop in an implant in the software and show the patient on the screen in real time that they are a candidate, how that would look, and talk about that surgery process very easily, sitting chairside in the hygiene room if necessary. Same thing on the dental sleep medicine practice side of what we do. We can show them a volumization of their airway and talk them through, the case acceptance for a sleep appliance and taking that next step to get tested, because they can visualize their own anatomy, which is huge in their ability to accept the cases and accept treatment. If you haven't taken the leap into integrating dental technology into your practice, and specifically the cone beam technology, I would say that you're missing out on a huge potential for your practice, for your patients, and for your team. This integration of dental technology, you can see more, you can do more confidently, and you can expand your clinical armamentarium, your clinical skills. From a staff standpoint, they so much enjoy their jobs more when they can take a piece of technology and get excited about their job. And from a patient standpoint, there's no better way for patients to understand their care, take an active role in their care, and to talk about your practice and to integrate this dental technology.